The WFSA thinks it's really important to give education and training a priority, and that's because it's estimated that over the next 15 years we need to train at least 500,000 anaesthesiologists just to meet basic surgical needs.
The WFSA selects candidates from poor or middle income group of countries and they send them over. We train them in respective specialties. In Vellore, in Christian Medical College Vellore, we train them in intensive care. So we increase the number of seats in Vellore, and we now tend to get candidates from all over, right from Africa to Nepal, even from Papua New Guinea we are getting a candidate. So it's spread all over.
Our model for training is to develop fellowship training programs, and these are short-term training attachments mainly in lower and middle income countries, close to where the trainees' home countries are. The trainees are working in places with similar resource problems to what they will be facing at home.
I work in Zimbabwe, in the capital city Harare. I work for the Department of Anesthesia and Critical Care Medicine, and this department covers the 2 referral hospitals in the country, which are also the 2 hospitals, the 2 teaching hospitals in Zimbabwe.
A unit where works together anesthesiologists, gynecologists, and nurses. So they were like a team, the anesthesiologists, which I work, with them hand to hand.
From day one, I landed, and it's like you're part of the family. Everyone welcomes you. They want to know about you, know where you're from, and they also want to, show you around their country, try their different cuisine, their different cultures. They teach you a lot about it. So I found that very interesting.
They treat me for the first day like a family. They support me. We did seminars, we did workshops, we did clinical cases, and as I said, they treat me like a family from the very first day.
The idea was for me to become a better regional anesthetist so I can better teach my peers. So since I've gotten back, I've started this health education leadership program in Zimbabwe, which is about curriculum development. So I'm currently working on developing a curriculum in regional anesthesia to sort of change the way we were currently teaching regional anesthesia.
The most important lesson that I learned there was teamwork, communication in the obstetric unit are essential for a good work, patient safety, a good quality of healthcare to the mother and his son.
The WFSA training programs are very important because what we're doing is you're taking people from low resource countries and you're allowing them to learn within a similar setting. And therefore they can learn how to set up similar teaching modules within a similar setting, and also it helps to benefit the patients. We're trying to improve anesthesia care. I think we are now in the era of the global village, so we sort of reduced this international anesthesia community into a sort of little village, and everybody's connected. You get to network, meet new people, learn how other people are doing things, and benefit. It's a mutual learning experience. In teaching you learn, and in learning you teach.
So one of the key things about the fellowships is that we rely on local volunteer faculty, and we've seen a really interesting thing with these fellowships, and that's that the local institution is very much strengthened by the fellowship program. So it's not just about training the individual, we've seen the strengthening of the institution and also the growth of regional networks. So anaesthetists or anaesthesiologists in the host institution maintain contact with the people that they've trained, and over time we see the growth of this very valuable network.
We have a training program running. We have at least 3 training programs running. So when we get these candidates, we see what their background is and what their necessity is, and we train them. We change the program so that they get most of it. When critical care was not a specialty in India, we went abroad and got trained ourselves, and we want to give it back to the world. And that is I think, in Vellore, that is what happens, and that's very important to give it back to the world.
The Fellow campaign has just been launched to provide funding for fellowships, and we really would encourage not only individuals but organisations to consider donating to fund a fellow. It's a really good value donation. More importantly, those people are going home to teach others and also fill leadership positions in their home countries. Part of the idea with these training programs is that we're developing a snowball type effect. If we can train 500 fellows in the next few years, then because of that snowball effect, they will reach 1 million patients.